Hi everyone, Dr. Jeff back with you this week with our co-op student Alexis. Noah's gone back to school and Alexis is going to be with us for the next 4 months. So, hi Alexis.
Hello, just to introduce myself, I'm a fourth year student at the University of Waterloo. I'm in the kinesiology program. In my free time, I like to go to the gym and spend time with friends and family. And for my extracurricular, I'm a student trainer for the badminton team at Waterloo.
Badminton.
Yeah.
I was there 45 years ago, dating myself. So I know we were talking today about stuff, and you came up with an interesting question.
Yep. So we're going to talk about what are trigger points today.
Yeah. So what is a trigger point?
That tight feeling that you have in your neck sometimes, or like your muscles, like in your arm, that's a trigger point.
So it's almost like a knot.
Yeah.
That you get, and you get this real tender spot.
Exactly.
You know where it is, and some research kind of shows that could be coming from something called a motor end unit. So every muscle gets nerve innervations from a main nerve. When that nerve goes through and tells the muscle to contract, the whole muscle kind of fires up and contracts. And that area where that nerve goes into can be hyperexcitable. And sometimes with overuse, fatigue, or something happens to it, and that area gets very, very excited. And what happens? The muscle kind of tightens up right on that spot, right around that nerve.
So next we're going to talk about what causes it.
Yeah.
So some things that can cause it are like some poor posture, prolonged posture, exhaustion, as well as trauma. So like getting hit like in the leg, you might have that tender knot feeling. Or like a long day at the computer or on your phone, you might have that tight feeling in your neck. Or like a long day of a long practice of badminton, you might have that sore knot
sore
feeling
elbow.
in your arm there.
Yeah.
Yeah. So
what do we do for that? Well, there's a number of things we can do for that. The whole idea is trying to get the knot out.
Yeah.
A number of ways we can kind of get at this. One way is called an ischemic method. So the whole idea is you're trying to pinch off the nerve supply to that muscle. So you kind of come in and, wherever it is, here, you kind of find that knot and you're trying to get on inside of it, and you're just going to hold on to it for, 20 seconds, a minute, 5 minutes. You'll know when it releases. And this is what it's doing is we're trying to cut off the nerve supply to that muscle. So the muscle kind of runs out of energy. It's very hyperexcitable. It's burning a whole bunch of energy. So we want to cut off that supply. So we kind of hold that until the muscles decide, I've had enough, and it relaxes out. Another way I like to work on is called ART, active release therapy. We've talked about this before. So I'm going to come in, I'm actually going to move the muscle. I'm going to find where that knot is. I'm going to go over top of it, around it. And what I'm trying to do is I'm trying to get the muscle, I'm like kneading the muscle, trying to get the muscle to relax and smoothing it out. I'm also getting on the nerve. The nerve's going to kind of slide under my finger. And the whole idea is we're going to try and get that nerve to work a little better so it's not quite as excitable as well. A lot of massage therapists and some chiros use something called myofascial release. So we're going to put a little bit of cream on. We're going to come in and we're going to really rub hard across that muscle. So instead of going along the muscle fiber, we're going across the muscle fiber. And we're trying to really bang this knot out. It can be very painful when you do that. It can cause some bruising. It's quite effective in getting rid of it. But you really kind of have to work on that. Again, a massage therapist, or even at home, if you want to put some cream on, you can work on it yourself. Some chiropractors, some physiotherapists, acupuncture will use something called dry needling. So they'll actually take a needle and they'll insert it into the knot, into that neural junction. And again, what they're looking for is they're looking for the muscle to, I call it, explode. So the muscle just kind of explodes out, it relaxes itself, and the knot goes away. So those are some ways that we can treat it here.
that's awesome. Okay, next we're going to talk about some ways to prevent it. So we can do that by targeting some of the ways that cause it. So for example, your posture at your desk or on your phone, you can work on having some better posture while you're using that technology. As well as when you're exercising, you want to make sure you're doing a really good stretch afterwards. And then the last thing is making sure you take frequent breaks to keep your joints mobile.
Yeah, I know that. I know they say, for if you're exercising hard for 40 minutes, you should spend about 20 minutes after stretching out. I certainly don't do that, which is why I like to go for massage, because I'm guilty of not doing a good job of stretching after. But you should really stretch. That's really important to keep those muscles from really knotting up on itself. So that'd be a good thing to do.
All right, well that's great. So for for me, I personally find that I get some low back pain after I exercise. So maybe we can take a look at that and see what we can do for that.
Sure.
Okay.
All right, so Alexa was talking about being sore in here, and quite often we're talking about the gluteus medius or the piriformis, and so if I come in, if you kind of look right around where your pocket would be in your pants, your jeans, that's generally where you're looking for this one. That's right here, right?
Yep.
Yep. So I can feel it right. Yeah, I can feel it right there.
It's tender.
Yeah. So a couple ways I can do this. One is I can come on and just put my thumb on it and hold it like that, and try to hold it. What I find easier for me to do this is I actually come in and I'm going to use my elbow. It is a pretty big knot. So what I like to come in here is, so I'll find it with my elbow, and again you use different parts. You use your thenar, your elbow, your palm, your thumbs, your fingers. I'm going to come with my elbow. Oh yeah, I'm going to come right in here, and that's not very pleasant.
No.
So I'm just gonna kind of hold that a little bit. Sometimes I'll move my elbow around a little bit if I really want to punish them. But I'm just gonna hold that for 20 seconds or a minute, and we'll see how it relaxes. It's not relaxing yet, but it's going to come on soon. But you can go online, and there are actually some devices. People that get sore traps, is actually things look like shepherd's hooks that you can kind of go on, and you kind of push on it and hold it on yourself, or there's different devices. Again, you can, for this, Alexis could actually sit on a ball, like a tennis ball, or a golf ball is a little too small for your butt, but a tennis ball or something like that, sitting on, it's starting to go now, sitting on that would really help. I know sometimes I get it when I'm driving, and I actually put my fist on it to try and release it a little bit, to sit on my fist, and that can help. You can get it kind of different devices to try and go on your elbow or go on your thigh, whatever it is. There we go, a little better. For another 10 seconds, and so some devices again you can get at home to try and do this yourself. It's kind of tough to do this one yourself, but there are devices you can get at home to try and help with these things. There we go. That's starting to release a little bit. Still a little sore, or a little better?
It's very sore.
Yeah. Okay. Hold it for another few seconds here. Okay. Stay there for a sec.
Okay.
Yep. Again, this is another area that Dr. Barela could put in a dry needle in there and relax this out. How's that when I'm poking there now?
It's good.
A little better?
Yeah.
There you go. Okay. So that's some ways that here at the office we can kind of work on those trigger points to try and get them to relax out.
Alright, if you like this video, please leave us a like, and if you want to subscribe, we really appreciate that as well. Share with your friends if you think they'll find this interesting as well, and then leave a comment if you have any suggestions or any feedback for us. And as always,
Here at Goals with the Wellness,
we
got
have
your
your
back.
back.
There you go.
Okay.